Good morning, everyone. But sadly, I have to report that 3 more Albany County residents lost their lives last night. And my prayers and condolences go out to the 3 families. And that makes 175 since the outbreak started. 2 are males, 1 is a female. Yes, they're all in their 90s, but it's still a tough time. And they had underlying health issues. But I do want to say to the families, we are thinking of you, and we're thinking of the other 172 families that this happened to, for a total of 175. It is a tough time that we're going through, and it's tougher when you lose somebody. Regardless, even if we're in this COVID-19 world, it's still tough to lose anybody that you love near and dear. But it makes it harder. It makes it a lot harder. So again, our prayers and thoughts are with you. So far this month, we lost 15 people as of today. We now, think about it, 15 people since December. So it makes it tough, what we're all going through and for these families. So as of today now, though, we have 7,452 positive cases of COVID-19. 2,546 people are currently under mandatory quarantine, and we have an increase today of 177 new cases overnight. Of the new positive cases, we know 21 had close contact with positive cases, 15 healthcare workers, and 141 don't have a clear source of infection. Over the last 5 days, our average has been 176.8 new positive cases each day. That's slightly above the 170 of yesterday. As of today, 27,399 people have now completed quarantine. Of those, 5,947 tested positive for the virus and have recovered. That's an increase of 43 recoveries since yesterday. There are now 80 people currently hospitalized from the virus. Yesterday, we're at 98, so we went down 18 overnight. That's a steep drop, bringing us down to a level we haven't seen since December 2nd. So that's some good news, but there were 10 new hospitalizations overnight. So far this month of December, we've had 120 new hospitalizations since December 1st. That's roughly 11 hospitalizations each day. 15 patients currently are in the ICU. Yesterday it was 14. Again, I hate to sound like a broken record, but I continue to tell you, wear your mask, clean your hands, stay 6 feet apart, and cough into your arm. And, one of the good things about today is, after talking to Dr. Venditti yesterday and putting the guidance to have that hospitalization go down, or people recovering quicker and going out, is really good news. We want people getting sick, but the fact that they have new ways of treating people and getting them in and out of the hospital is good news. But also, I want to remind your viewers that they got a long road ahead of them. It's not the fact they get out of the hospital, they still have to go to lung doctors. They still have to deal with issues that are going to go on for a long time after getting out of the hospital. So they're not out of the woods, but at least it's not the alternative. So I know we still haven't got clear guidance on the microcluster zones. We're still waiting on that. So when we find that out, we'll let you know. I know the governor's making a big announcement today at 11:30. So we'll find out what's going to be said at 11:30, whether he's going to address the Capital District or not. But I can assure everyone that we're doing everything to stay safe and continue to move forward. But again, under the guidance that we have gotten on hospitalizations and all that stuff, the fact that we went back down to 80 is good news, and maybe that's what he's basing it on with us here in the Capital Region, which is good. So we won't be looking at shutdowns and stuff like that. So some of the good other news last night, the FDA Vaccine Advisory Panel, composed of scientific experts, recommended the emergency use of the COVID vaccine, which is also good. The FDA is expected to start distributing the vaccine quickly, and hopefully New York will have its first dose this weekend and beginning delivery to our nursing home residents and workers. So we did get guidance on our Shaker Place, so how it's going to be addressed with the nursing homes here in Albany County. For our nursing home, Shaker Place will be getting its first batch of vaccines from Walgreens on December 21st. So December 21st. The injections will be broken into 3 different batches. So for those who received the first shot, will get their second shot 3 weeks later. So if you get your shot December 21st, January 11th will be their second shot of the dose. The third and final visit will be 3 weeks after that, gives the final dose to the second group, so as it continues on in going through our nursing home, which is good news. So all the vaccines have been distributed to those who want it at Shaker Place beginning in February, besides the residents first and foremost and the workers. It's estimated it's going to take about 6 weeks to do everyone in our nursing home. So just to briefly say some of the good questions, yes, we will be dealing with the residents, whether or not they want the shots, the workers want the shots. So that's all going to be in place before December 21st, obviously. So when we start our first round of doses, we know what residents want it and which residents do not want it. I also want to remind our young people in Albany County to take the time to send the residents Christmas cards, or e-cards, I should say. With the holiday upon us and Kwanzaa and Hanukkah, please take the time, bring some joy to not just the residents, to the workers, to any nursing home in Albany County. Please, the school kids, I know you're looking for something to do. Most of you are virtual now. Take the time, send it out, and it is going to make the difference in someone's life, because the light is at the end of the tunnel. We're almost there. And again, it's going to take time. The shots are going to be coming in place, but again, as the vaccine continues to roll out throughout the community, it's going to take a couple months, but we'll be there. But we need to stay vigilant. We need to continue to do the same stuff we've been doing. To the residents, thank you. Christmas is upon us. The holiday season, we're just getting over the Thanksgiving holiday, and we know the effect that has had on our numbers and our deaths here in the county. So please, by all means, do the right thing, stay vigilant. We don't have time for COVID-19 fatigue. This is about the health and safety of everyone around you, especially if you go out shopping and all that stuff. I encourage people to use the restaurants, but do takeout and or get it delivered. Support our local restaurant workers in restaurants, because we want to see them there in the springtime. Support who you can. You can shop online. You can be creative. You don't have to go to Amazon. You can. Stuyvesant Plaza has stuff set up. Colony, Crossgates. You can still do all that and do it safely. And because that's first and foremost, we want to keep the residents safe of Albany County. So please, by all means. For the e-cards, as always, send it to Albany County Kids Care at albanycountynewyork.gov. Please take the time to do that. I also want to remind residents that testing is still available at the Times Union Center on Mondays and Fridays. You also get testing at the Waterville Dome on Wednesdays. We may expand that because we're getting such a demand in Waterville, which is, that's good. We want people to get tested, and we want to make it accessible. And that's the one thing I've said this, and I'm going to continue to say this, we're working on and hopefully rolling it out so we can get more people tested at higher numbers to really see where the infection rate is as we go forward. I can't thank Whitney Young enough, not just for the mobile testing, but for their partnership through this whole thing. But you can call them for an appointment at 518-465-4771. We cover the cost if you don't have insurance. And as UAlbany also, you don't have to pay. You don't need to show insurance. Good partnership with the state of New York and the Governor Cuomo for paying for that. You don't have to pay co-payment. If you go to a doctor's office, yes, that's some of the questions we keep getting. If your insurance has a co-pay, you have to pay it. It's like an office visit. So be it $15, $30, whatever your co-payment is, you do have to pay that. But if you go to UAlbany or Whitney Young and you don't have insurance, you don't have to pay. So please, you should know what your co-payment is for your insurance. But for UAlbany, 188-364-3065, and Price Chopper, CVS, Purdy One, Walgreens. I could go on. Thank you for everything that you're doing and continue to do in the neighborhoods. So some testing sites do require appointments, and some take walk-ins. Please be aware of that. Go to our website, because that's another complaint we get. That's why we established and put the website together, so people would know the wait times. They're as accurate as we can make them, obviously. And, I know that people are getting mad because it said 20 minutes and I was there for 45 minutes or an hour and a half. The walk-ins, makes it longer, and if you make an appointment and you can wait a day or two, you should be in and out of that place within an hour. It's pretty good instead of waiting 3 days and sometimes 7 days to get results back if you get a PCR done. So if you want that rapid test, you got to be patient, please. It's a different world out there, and that's what we're dealing with, and we continue to deal with. And to everyone that has children or adults or grandparents or parents, just a friend, it's different. The holiday was tough for a lot of people. This holiday coming up is tough for a lot of people. People like to be around people. That's who we are. We like to socialize. People love to hug. They love to get out. They like to have drinks with their friends or just hang out with their friends. Please just do it safely. Wear a mask and continue to cough into your arm, clean your hands, and stay 6 feet apart. We'll get through it. I wish I could say it's going to be over within February. I'd like to say it's going to be over in March. I'm hoping by the springtime that we see things start to open up and move into a different direction. But you got to look at the vaccine. It's going to take time to get out to everybody. And that's what people have to understand. So I'm scared on 2 levels. 1, because of the Christmas holiday and New Year's coming up. But 2, that people are going to think the vaccine's there and now we can go out. I don't have to wear a mask. I don't have to do this. I don't have to do that. Please just think of other people, and we'll continue to get through it. And it's one of the reasons why I'm proud to be the county executive in Albany County. We have so many awesome residents that continue to do the right thing and will continue to do the right thing and get through it. I'm not going to argue over the science of the mask. That's why I brought Dr. Venditti in and other people. I say this to everyone. When you're out, and I was out, and I purposely, the guy pulled his mask off, waiting for me to say something. I'm not going to argue with you. We've been doing this for 9 months. I'm not going to argue with you. I know some people believe in it, don't believe in it. I'm not going to argue with you either. All I can just say is we need to get through this. I know you don't want government or people telling you what to do, how to do it, but we need to get through this health crisis, and we have economy crisis on top of that. We need to continue to help people put food on their table, pay their rent. There's so many issues that I see with DSS going on, with our SNAP, HEAP, more people going for more assistance than we've ever had before, in alarming numbers. And we've controlled the homeless problems here in the county, and now we're seeing more and more of that families. And I can say to the viewers, it breaks my damn heart when I see a mother with her kids on the streets that are sleeping in a car or just have no place to stay for the night. And it falls into a variety of categories, and I don't want to go into them all. But as we sit back and we look at the holidays here, be thankful for what you have. Be thankful. And it will get better. It is going to get better, and we're all going to get through this. So please continue to do the right thing. The mental health support is there. Don't be embarrassed. Don't be afraid to call it. No, we don't keep track. We're not going to send the police to your house. We're not there. They're not there to arrest you. They're just there to listen to you. I'm going to get Dr. G on, and we're going to get a psychiatrist that deals with children to talk about children's issues and signs, parents, what they should look for. And honestly, I don't want to call one of the news media outlets that are here out. It was a story I saw there, and they had it talking about children, and it's what we're going through, and you really need to take that time and address it with your child and maybe have them talk to somebody. We don't know all the answers, and I think talking as a parent, my kids look at me like I don't know what the hell I'm talking about, and that's what we all get as parents. The kids think they know better, but again, we need to put ourselves in their shoes, and we'll get through it. But our mental health support line is available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. And yes, I want to put this out, it's for males too. Males get raped too and have sexual assault problems. So please don't be afraid to call. Call the number. The statistics are there, but for some reason, males are more afraid to come forward than females. It's there. It's in confidence. Karen Ziegler's team does a phenomenal job. I have to tell you, what they have to deal with day in and day out, regardless of this crisis, is something that would break anyone's heart. And to that whole team there, thank you for what you do. But please call that number if you need it. 211 with United Way in New York State hotline at 188-364-3065. And before I end, I'll say this. I'm hoping not to see anyone till Monday. I'm hoping that our numbers stay good through the weekend and we have nothing to report. So if I do have a presser Saturday or Sunday, it's because something went sideways. Again, I've said this, it's a marathon, not a sprint. It's going to be a while, and unfortunately I was right. I was hoping I was wrong. I wouldn't mind seeing the headline, County Executive was wrong, we opened up and everything's fine 2 months later, but it's not the reality of what we're in. So please be patient, work with us, be part of the solution, not part of the problem. It's easy to beat us up, it's easy to sit there and say we're doing wrong, why is he talking about it, why is he putting numbers out there? I'll challenge this to the people that have, and you know who you are, you sent me stuff. I'll challenge you this. Give us the solutions to the problem then. Be part of the solution, not part of the problem. And if you don't like what we're doing, tell us how we can do it better. But wearing masks saves lives. Staying away from people saves lives. And you'll see the data come out of Florida and the numbers that they're hiding. It's all going to come out. Maybe not today, maybe not tomorrow, but 6 months from now. You're going to see the difference of the governor of Florida versus our governor in the state of New York or California or Massachusetts that have saved lives because you have to make difficult decisions. But please stay safe and healthy out there and continue to be doing stuff in the right direction.